Good afternoon. I am Dr. Tejaswi Prasad and I'll be presenting a basic science translational research on genome-wide DNA methylation analysis reveals epigenetic dysregulation in pterygium. We have no financial disclosure and this study was funded by SERB Startup Research Grant. Pterygium is a common ocular surface disorder characterized by wing-shaped fibrovascular growth of the subconjunctival tissue leading to vision impairment. About 10% of the patients who seek eye care in India have pterygium at least in one eye, and in our institute in year 2023 we had done 2757 pterygium surgeries and this number keeps increasing. The prevalence of pterygium in India ranges from 3 to 16% and has the highest odds ratio of 3.4 in the southern part of India. So we know the risk factors of pterygium, that is exposure to UV rays of sunlight, usually presented in older age group who are involved in agrarian and manual labor, usually involving low socioeconomic status and patients who have geographical location closer to the equator. Interestingly, there is a molecular similarity between melanoma and pterygium, where UV radiation causes DNA damage and ultimately leading to cellular damage. So we wanted to know what are the epigenetic alterations that occur in UV irradiated ocular surface. So this review article reported that a genetic predisposition is crucial for the development of pterygium and sunlight is only a trigger factor which causes growth factors. So why study genetic changes in pterygium? We know that UV light causes genetic modification leading to abnormal tissue growth and epigenetic changes switch gene on or off. So for all the epigenetic changes, modern translational research is interested in DNA methylation because it yields a good targeted treatment. So DNA methylation is adding methyl group to the cytosine base of the DNA, which causes DNA to be methylated and hence the gene is turned off. And in a hypomethylated state, the gene is turned on. So we wanted to understand what are the epigenetic changes in pterygium pathogenesis. And when we did a review of literature, the genome-wide methylation analysis was largely unexplored. So the objective of our study was to conduct a genome-wide methylation analysis to investigate the dysregulated methylation pattern associated with pterygium. So this was our methodology, where the study tissue sample was retrieved from progressive nasal pterygium and this control sample was retrieved from the sun-exposed part of the conjunctiva from a patient who was undergoing small incision cataract surgery who consented for the study. And an enrichment analysis was done to identify hyper and hypomethylated genes. So these are the sample details where 9 pterygium patients and 6 control patients had similar age and gender profile. The exclusion criteria was patient with systemic illness and patient who had atrophic, recurrent and double pterygiums. So coming to the result, here in this volcano plot, you can see differentially methylated probes where we identified 283 hypermethylated and 116 hypomethylated genes. In this heat map, you can see there is a distinct cluster of genes which can be observed in the control group when compared to the pterygium group. So gene enrichment analysis showed the pathogenesis which was involved in pterygium, that is extracellular matrix remodeling, fibrosis, angiogenesis and stress-induced damage. So these are all the genes that we have identified which are involved in pterygium pathogenesis and their respective biological processes. The red highlighted genes are novel genes which were identified in our study. So these are all the drugs which are targeting these genes, and we know that these drugs are already used in cancer therapies. So the merits of a study are that we have identified novel genes which are linked to pterygium pathogenesis, hence expanding our understanding of disease mechanism. And this establishes a potential link between pterygium and cancer associated pathways. This way paves way for drug repurposing, highlights the role of epigenetic and molecular therapies which can be a promising alternative for surgery. The limitations are the sample size was small, which may limit the generalizability, and here we have not evaluated other grades of pterygium to do a DNA methylation pattern in such pterygium grades, and use of methylation specific qPCR for precise gene validation. To conclude, our study used methylation profiling microarray to identify key genes, and we have identified the processes that are involved in pterygium pathogenesis. This expands our genetic understanding of pterygium pathogenesis and also paves way for future research on methylation dysregulation of pterygium. So by identifying this novel genes in the pterygium pathogenesis, it opens way for targeted therapy. Epigenetic and molecular therapies which are used in cancer can be used as a topical and systemic application in pterygium. Most importantly, this study bridges the gap between ophthalmology and oncology, paving way for precision medicine approaches in treating pterygium. Thank you.
Thank you.
What are the weaknesses of the study, if any?
Limitations,
Weaknesses or limitations, yes.
Okay. Ma'am, her sample size was comparatively less. This was limited by the funding, and here in future we are going to increase the cohort of the study, and we did not include other pterygiums such as temporal pterygium, double pterygium and recurrent pterygium. We restricted only to nasal pterygiums which are progressive in nature, and we had to use a methylation specific qPCR which was not involved because of the limitation of the fund, which we'll be doing in the next step of our study.
I'm not sure whether you mentioned it, but what about the other eye of the patients?
Only one eye per patient was
yeah,
used
but
for the study.
did the patients have unilateral pterygium or bilateral pterygium?
For this cases, only unilateral pterygium was included.
Only unilateral,
yes, ma'am.
Right. So you could have taken the other eye as a control as well.
That was not in the scope of the study.
And any impression cytology done?
No, madam. It was not done. It was not there in the scope of the study.
Okay, fine.
Thank you.
Yes. See, the pathology is supposed to be very different in recurrent versus the. So several studies have identified the P53 gene as far as the recurrent pterygium is concerned. So it would be interesting, as you said, when funds permit, to compare it with, because that may be a different pathology altogether, different gene types you might find there.
Yes, sir. Very interesting question, but we are taking it in the next part of our research.
Okay. Thank you.
Thank you.